Hi, Laura DiGiulio here, registered massage therapist and NKT practitioner. I'm at the beautiful Coastal Sports and Wellness in Bedford, Nova Scotia, and I'm going to talk to you a little bit about the long head of the bicep. So the bicep muscle is the muscle in the front of your arm. It is responsible for not only flexing the elbow, which is really not its primary function, but also supinating the forearm. So this is pronation of the forearm and this is supination, so turning the palm up. That's a primary action of bicep. Bicep is named because it has two heads, bi meaning two. And so its top attachments come in two parts. One runs up a little groove in the humerus, the arm bone. That groove is called the bicipital groove or the intertubercular groove, and attaches to the top of the scapula or the shoulder blade. And the other, the short head of the bicep, runs kind of forward and attaches to the coracoid process, a anteriorly jutting process also from the scapula. Part of the action of the long head of the bicep is to prevent downward displacement of the shoulder, and so it essentially keeps the shoulder from dislocating. It's one of the muscles that does that anyway. And what often happens is that bicep tendon runs through that little groove and it's held in place by a ligament. And what often happens is that ligament tears and ruptures, and so it makes the long head of the bicep very susceptible to popping out of that groove, and what tends to happen is it moves medially or towards the chest. That happens because our postures tend to be rounded forwards, and that rounding forward perpetuates the movement of that tendon towards the chest. And so this can cause a myriad of dysfunctions, including weakness in the upper limb, but can also manifest as pain when you're doing any type of overhead pressing. So anything done up overhead causes pain or pinching or sometimes weakness in that joint. And so one of the ways that you can help fix the position of bicep is to replace it yourself. So there's lots of different dysfunctional patterns that can cause the bicep tendon to move out of its groove, and certainly you should be assessed properly to find out what dysfunctions are happening for you. But generally speaking, it's because we're perpetuated by tightness in the chest. So what you want to do is you want to release the chest, and so maybe you find a tight spot in the pec muscle and you do external rotation. Find another tight spot and do some external rotation of the shoulder, moving the arm out to the side to kind of allow the muscle to run underneath your fingers, and you're just trying to release that muscle. And so you don't want to cause a lot of pain, just gentle release of that muscle, moving in and out of internal and external rotation, softening up the muscle of the chest. And once you've done that for a minute or two and softened up that muscle, then you can replace the bicep tendon. So what you want to do is you want to have your fingers kind of at the front of that shoulder joint, and what you'll feel is a little bit of the edge of the deltoid, the shoulder muscle. And sometimes you can feel this rope, this ropey tendon, and that's often the long head of the bicep if it's out of its groove. And so you just place the fingers here. You start from external rotation, so your arm out to the side like this, and your fingers are going to run towards the outside or towards that shoulder as you internally rotate the humerus. So essentially what you're trying to do is you're trying to push the bicep tendon back towards its groove. And so you're rotating the humerus to rotate the groove towards the chest as you're pushing the fingers out. This doesn't have to be hard. You're just gently pushing that tendon, encouraging it to come towards the groove. And you may or may not kind of find it pop back into that groove. You want to do this several times. And then what you can do after you've done this several times is do a little activation of the mid-back to keep the shoulder rotated back so that you're not falling forward and perpetuating again the movement of that tendon out of the groove. So you're squeezing the shoulder back and down as you externally rotate the shoulder, helping to keep the shoulder in a position that allows the bicep tendon to run nicely through that groove. If you think this is a pattern that is happening for you, it's causing a lot of dysfunction, try that replacement and see whether or not it gives you a little bit more mobility and a little less pain through that joint. If you're not sure whether or not that dysfunction exists for you, get assessed by an NKT practitioner.